County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome to Community Close-Up. I'm your host, Sharen Skelly, and today's guest is Tanya Shute. And Tanya has quite an incredible title, so I have to look at it. The Director of Integrated Health Strategies and Partnerships, and that's at the Southeast Grey Community Health Center, located in Markdale, but you have satellite offices. Welcome, Tanya.
Hi, Sharen. Nice to see you after so long.
Yes. We're still doing Zoom meetings, and Zoom shows, but we did do a couple in person, but then we found that people were still, sick with COVID and that sort of thing. So we thought just to be safe, we would have them by Zoom for a while yet. Now you have satellite offices. There's the main center is in Markdale.
That's correct.
But we have satellite offices. So where are they?
So we have one satellite location that is in the lower level of the municipality of Chatsworth building. So right when you're going out of town on the highway, you look kind of to your left, you'll see up on the hill, the municipality of Chatsworth building. If you kind of go around into the back, we have a small clinic out of there. We also have two sites in Dundalk. So we have one site, which is called Dundalk Medical Center. It's right on the main road. And we have the Erskine Center as well. And that was the former Erskine Presbyterian Church that was gifted to us by the Erskine Presbyterian when they were closing their church down. So we use that for all sorts of different activities, community partners, etc.
Right. Yes, I think I've delivered a program in there, and it's quite lovely in there. It's nice.
Beautiful.
Space, and it's pretty central in town. People can walk if they live in town, so it's a nice place to have programming, and it's nice and bright, even though it's in the basement. Some of the programming is nice and bright, warm. So so you have those centers. So I guess we can start off by just saying, what if people aren't familiar with the Southeast Grey Community Health Center, what exactly is it, and what is a health center, community health center?
Right. So the community health center model, essentially we're primary care. So we have doctors, nurse practitioners. We also have social workers, dietitians, chiropody, which is basically with your feet. We have, I think I mentioned physiotherapy, kinesiology, all sorts of kind of what we call allied health professionals that are wraparound services. But then we also have what we call health promotion activities as well. And that's through our community developer and health promotion, health promoter. And some of those activities that we end up doing through those, what makes us unique is that all of our programming is free. So we have things like Tai Chi, yoga, we have dance Zumba classes, we have a free community gym that we're hoping to be able to extend the hours and have people come in here when we're not here to use that gym facility. We do things like income tax program, and we help people file their income tax for free. So everything we do is essentially trying to help people in both that reactive way in terms of if they have some kind of disease management than a traditional doctors and nurses, but then a real focus on the health promotion aspects of it. So keeping people healthy and identifying what those needs are.
Well, that's really the best of both worlds, but staying healthy and keeping healthy and preventing people from getting to the point where they become chronically ill, or, and starting off like families. Some of the things we're going to talk about that you do, but just things like I like the idea of the skates. That's one thing, for instance.
Yes.
Like that's something that can keep people active in the winter. And, everybody should be active in the winter, and that can teach children, modeling healthy behaviors during the times when perhaps you want to stay inside on a nice winter weekend, instead of staying inside, perhaps playing on a device, strap on some skates and go out and skate. And sometimes you can find a place to skate that, well, there are free skates, you can go out, participate in that. So you're modeling healthy activities, and that prevents, and teaches children how to skate, and they can carry that skill into adulthood. So those are things that we can do to, those are skills that, they're very handy to have, and you can teach your kids to skate too. So yeah, those are things that, more of us should do. So those are really great things that you're doing. Yeah, that it's not only helping people when they're not well, it's helping people stay well and learn to be well.
Yeah. And I think with the skate exchange that I think a lot of your viewers will appreciate is, especially with kids, your feet are growing. Sometimes you start out the school year with one size skate and you end up with something else. So having something like a skate exchange, which is free, it doesn't mean that you have to bring skates to get skates. We have people from all over coming to drop off skates because they have pairs that don't fit. And we have people from all over coming to pick them up. So it's just an idea exactly what you're talking about, keeping healthy, keeping active, but, not having to spend the money year over year to upgrade skates because our feet are growing. But yes. Adult skates too.
And I thought of you the other day. I was looking through a flyer. Lots of people don't like getting flyers, but I do, and I recycle them. Because I looked at has they gone up in price? Skates gone up in price all of a sudden? I don't know, but the prices were outrageous for children's skates. And I thought, wow, they have a skate exchange, that popped into my head. And I thought, but children need skates or want to skate, there's a way of getting them. So, it's a real, it's a bonus to have things like that for everyone, and also for families that can't afford them, but just for any family, really. So
it's environmental, right?
I know it's just
environmental.
It's everything, just everything.
Yeah.
So that's one thing we're talking about, health promotion. So other things that you do there are health promotion, taking care of healthy families, but other things that you do there, what are they?
Well, if you'll indulge me for a few minutes, I'm just going to talk a bit about the food program, because honestly, since COVID, during COVID and post-COVID, much of our attention kind of got redirected to food security. Recently, the Health Unit and United Way, some of our partners at Poverty Task Force, released a lot of great data talking about what people need a month just for groceries, basic groceries, something around the neighborhood of $1,100. And we know that people who are on Ontario Works in our area right now, if they're spending 46% of their income being, upwards of $700 and something, they're not being able to have an individual, they can't sustain, let alone family. Granted, it changes. But the other thing is stuff like rental prices, even rental stock. The average price of houses being around, our apartments being $1,500 to $2,200. So when you do the math, people are coming up short by about $400 every month just for those two basic things, food and shelter. We all know, and we can all appreciate how much stuff is appreciated. It's gone across the board where everybody's feeling that pinch right now.
That's right.
But we do know that kind of that food security in our community has been at an all-time high. We have an unprecedented demand. So at the health center, we do, and I'll mention in a moment the food programs we do, because at the end of the day, we want to make sure people have food in their tummies. But what we do is a lot of advocacy around things like the affordable housing. We're at a lot of tables where we are making sure maybe healthy public policy is being shaped to change things so that the income portion, we talk a lot about living wage, that people should be making. I believe the amount is $20.70. That is what we need to make, just to make sure we're able to make the needs, make ends meet. So we do a lot of advocacy provincially, regionally, on all of that, to kind of realizing that income piece is so important. But in the meantime, like I said, we want to make sure that we're able to offer programs that get that food to people when they need it. So we do partner with Grey County, municipality of Grey Highlands. Our municipalities are great here. Township of Southgate, they actually flow us money to run a lot of these either food programs or rec programs for their community. And I think we do a really good job with it. We have really good numbers. We work with OSHARE up in Owen Sound, local food banks, churches, and grocery stores, just all to kind of create better access to food. So one of the neat models of what we do is there's a program out there called, we were talking about environmental friendly with the skates. So this is similar. So it's called Second Harvest Food Rescue. And Colleen up at OSHARE has a fantastic, she's kind of like a regional food distribution center. And she's working with the local grocery stores to look at any kind of surplus food they might have. So sometimes it's things that have been dented or about to go reach their expiry date. Sometimes it's just a surplus, like after Christmas or Easter, there's a surplus of hams or turkeys. And so what she'll be able to do is repurpose and distribute them. Some of them she's processing on site for that meal program they have there, but recognizing we're a bit of a depot for all of Southeast Grey. We get these food shipments coming down and we're able to turn them into meals. We're able to freeze them into meals. We're able to get milk to people, you name it, with this really unique way of moving food instead of food waste. We've been able to really reach a lot more people. Of course, we had our Your Unique Meal, the Yum program that was born just before COVID. And really what it was intended to do was recognize that in food banks and a lot of other food places, sometimes we don't have the gluten-free or the dairy-free or people who have certain needs. They're not typically the things that people donate to food banks, and they're much needed. So we came up with something to augment that food bank piece, which is nutrient dense meals that we could freeze that would be friendly for people. And we've been able to continue that program, and it's a volunteer led program. So we have volunteers who come in, who cook, we can freeze the meals and we can kind of distribute them. Another thing we do is the Good Food Box program. Everybody's heard about Good Food Box program. And again, through some really great work on behalf of United Way and OSHARE and a lot of our food networks, the health unit, we have a token system where we're able to distribute tokens to individuals. So each month we have helped 62 households or 140 people with having more access to that fresh fruits and vegetables. So that's really important. I don't know if you have any questions about those programs at all.
Well, yeah. Now, when they bring the food, surplus food to you from OSHARE, like you, or that depot to you, do you actually prepare the food or do you distribute it to people in raw form to prepare themselves?
Both. So there are some rules around it, obviously. So we're very mindful of kind of what those are, the guidelines, but some things we can just move along. Like maybe we got bagels this week and we have people coming to pick up their frozen meals. And we said, well, we got extra bagels. Would you like some bagels this week? Or, I went to OSHARE a couple weeks back and we kind of looked in the area where there was some of the items that had come that wasn't necessarily the fresh produce and the meat, etc. And I was able to get some canned tomatoes and bring them down and put them on the shelf we have here. Again, just emphasizing it's important we also work with the food bank because they are a really important piece of that whole system. But I think that with the limitation sometimes with food banks being so many days per month, it does sometimes create limits. And like I said, this is unprecedented times. Right. So we really have to try to work together in terms of making sure we can complement. So we do have an emergency food cupboard here. In the spring and summer, we work on the community gardens. And so that's a big part of it, the harvesting. We do some food fit programs. So it's almost like a take on community kitchens where people can come and learn more about making the food and processing. Like, what am I supposed to do with this sweet potato? And we can look at different recipe ideas. Sometimes we have larger families in our area. We have larger Mennonite families. We have just bigger farm families. So sometimes the smaller amounts of food weren't cutting it. So we do have an option, what we call the family casserole program, that we're able to distribute casseroles. And we came up with a really neat thing called the crock pot program. So some of the viewers might be familiar almost like with those Hello Fresh. People order online and you come with a box of ingredients. And so kind of a take on that, individuals got crock pots. We got a grant and they were able to have crock pots. And each week we would give them a set of ingredients. And they would kind of either go on Zoom or they would follow recipes and be able to make their own meals at home.
Really, really good idea. I like that.
And then the last couple ones I'll just mention from that, we have in Dundalk a community cafe. People can stay and have like a warm breakfast, or they might just want to have a breakfast to go. And then one of the things that we noticed with COVID, a lot of our kids have rely a lot on that Ontario Nutrition Student Program. So you come in, there's a breakfast program at school. Sometimes there's snacks and lunches that augment their nutrition throughout the day. And with COVID, people were staying home. And so the kids weren't necessarily guaranteed that food day to day. So working off of that, we also recognize summer can be a stressful time for families who, all of a sudden it's, extra meals throughout the week. So we had a grant through the Community Foundation, Grey Bruce. We put on a school lunches program. So kids would come and they get a few days supply at a time with brown bag lunches. They were able to bring them home. It was a relief for parents who were still working, and it got them out. Sometimes we could dovetail some activities going on to it as well. So just kind of, again, recognizing those gaps and then trying to see what's out there and then complement it.
Oh, wow. Now, I've had Alice on the show for last month, and she was talking about the Christmas hampers and the Christmas dinners. Now that's with the food bank. So do you have anything to do with that?
So in the years past, we've been asked by the firefighters, for instance, to be a storage site upstairs in the hall area at Dundalk, to be a storage site for the toy hampers. And in the past as well, the food bank has worked in Dundalk has worked at putting hampers together, and we could work with either, again, supplementing, or we might have identified clients who aren't necessarily on their list, but there are other organizations who kind of step up for that. And we are, again, at the end of the day, funded as a health center. So if we have a grant to do something specific, that's great. Otherwise, we're just going to support our partners and just try to, and in terms of those meals too, a lot of the churches around here will host meals, and maybe we'll buy tickets and we'll hand them out to certain families and clients if they don't have anywhere to go. And it's not even a money thing. Sometimes it's just an isolation thing, right? So we're always kind of doing that environmental scan first to see what's out there. But our community is really good when it comes to things like that. So we just have to tap into it.
That's right. There's always someone doing something out there, and we just have to look for it and direct people to the right place. Always someone doing something. So funding, who funds the center then?
Our funding comes through the Ministry of Health and Long-Term Care, and it gets flowed through what is now called Ontario Health West, which was formerly the LIN. And essentially what we're getting funded for is what they call FTEs, the full-time equivalents of doctors, nurse practitioners, again, that whole list of social workers, et cetera. We're responsible to the government for stats, for seeing certain clients, unique clients. We can't just say, oh, we saw 3,000 people last year and it was the same 5 persons over and over again to equal 3,000 visits. We want to make sure we have certain criteria we have to meet. And then for all the other things we do, we're very resourceful to look at what our grants are out there. And if there's something that we can co-apply and apply to with another organization, we will. Like I said before, our municipalities have been really good to us. The County of Grey has been really good to us. And we don't ask for a lot. We have an idea. We said, this is what we've identified. They're already 2 steps ahead of us. And then we can work together to kind of solve a bit of a problem. And then of course we take donations too. So our community members, a lot of people come and they can't give money, or they prefer to give time. They volunteer and they see the good work that we're doing. So we do have different avenues that our community members could give back to.
Hmm. Now, if someone needs or is new to the area, or they may not even be just new to the area, but they want to become a client of the center, or they say need a doctor,
Mhm.
how do they get to become a patient there or a client there?
So the unfortunate thing with where we're at right now with our funding and in the region is that we are completely full when it comes to rostered patients for our nurse practitioners and our physicians. With that said, if we had a newly pregnant mom, we had a new baby, we had somebody with pretty serious diagnosis that needed that immediate kind of care, we're going to take them in. By case, but right now we're not able to take anybody on. We do have a case put forward to the ministry to look for an increase in funding. And if they approve it, we'll be able to open up that wait list and take on few more thousand people to our panel size to increase that. But in the meantime, what we can do is we can invite people in to partake in any of those programs. If they want to come in for yoga, if they want to come in for Tai Chi, if they want to come in and see the social worker or see the dietitian, any of those things people can access without being a client of the CHC. Everything is open to everyone. We just have those restrictions placed on those two, on taking patients on, for instance. So I'm hoping that will change. And as soon as it does, we're going to communicate it loudly and widely on our social media and beyond, and let people know that we're open for taking clients again.
Okay, so if someone wanted to say, we'll just use, for example, they want to see a social worker,
Mm-hmm.
they go onto your website or Facebook page or whatever and find the phone number,
Yep.
and they just call, or how do
Yep.
they refer themselves?
No door's the wrong. Yeah, no door's the wrong door. Sometimes people call, they go onto Facebook, and Facebook has an option that you can message. If you message, it goes to us and we'll see it right away. And it actually comes out that says, this is a serious matter, do X, Y, and Z, but this is our phone number. You can call in and precipitate kind of that appointment on your own. But we definitely respond back to our Facebook messages, Instagram messages. People can call our main number. Sometimes people just walk in. So no door's the wrong door. If someone reaches out for service, we'll make sure that we have someone following up with them.
Okay. Now, we were talking about food security, security.
Mm-hmm.
You actually have the food bank in the health center?
No, we don't. No, the food bank's not actually located here, but we do have what we call kind of a pantry or emergency food cupboard. So if we do have it, and our primary care team is really good, we can ask people, as we're asking them, how's your knee feeling, or how's that inflammation? They might ask them, so do you ever find that you're having trouble making ends meet? And they have a really strong relationship with their clients. And if they say, yes, this is what's going on in my life right now, we're able to, again, have all those other services on site, including, potentially being able to provide some meal options. But then what we're doing is we're doing follow-up. We're saying, have you talked to United Way? They have a financial literacy program or kind of credit counseling. Have you ever talked to them? Have you done your income tax? We have a free income tax program. Maybe you're entitled to benefits you weren't aware of. So we do support clients beyond just kind of here's what's happening today. And like I said, it goes further to that than more of a policy levels as well. The unique thing we have at Markdale here is that we have a bit of a hub site as well as Dundalk. We have CMHA, Community Mental Health Association, on site. They have offices. We have Keystone Family Services, Child and Family Services. We have the Grey County Ontario Works. So we have a lot of services that we're able to provide. In Dundalk, we would have all those services, as well as sometimes we have legal aid will come in, diabetes, Grey Bruce. And so it's trying to make things as seamless as possible. So it's one-stop shopping. When people are here, we can, help you when you're here, and you don't have to worry about that transportation option, et cetera.
Mm-hmm. Now, back to the food bank. Is there a food bank in Markdale?
There's a food bank in Markdale. Yeah, we have a good relationship with them. And there's one in Flesherton and one in Dundalk.
Okay, so there are ones other than the one in Owen Sound. Okay, transportation. If someone wants to get into Owen Sound or another bigger hub, I guess maybe it would be Mount Forest or whatever. How do you have any ways? Transportation's always a big issue.
Yeah, so we work really closely with the client, with their family system to see kind of what the options are already out there. A lot of times it's just a matter of supporting them with a referral to the home and community support services. So they have the vans that will be able to bring people to programs or to appointments. There is the great transit route that comes down Highway 10 that links people. And sometimes people use that as an option. They say, I think I'm going to head up to Walmart in Owen Sound. And so we're going to support them in how that transportation looks, et cetera. So we do as best as possible. And even though it is a big barrier for our clients, fortunately, there are many neighbors and family members who can support. So who we're really kind of instrumentally calling and doing that support for would be individuals who are isolated or don't have that support with them.
Mm-hmm. That's right. Now you've got you're helping people with the food, and you don't have a drugstore in your clinic, but you do have a drugstore in the town. You've got a drugstore in Markdale, right? Yep. Do you foresee expanding, or is it it's going to stay the same?
Well, we have. So we've just, when I mentioned all the partners that have just kind of onboarded in Markdale, we just renovated the entire other side. You should come down for a visit, Sharen.
I haven't been there since COVID. There's
a big classroom now we have for people that they can book for community meetings. It's a community classroom. So you could, do what you may in that room in terms of being able to host something. That's where we now have our community gym is on the other side. So it's a brand new bright space, and we're just kind of working through some logistics around evening plowing, because we'd like to open that for some of our shift workers from Chapman's and individuals who commute back and forth and who want to use that in the evening or first thing in the morning. So you should come for a tour. That whole new side has been expanded. So I think when it comes to Markdale, I think we're sitting good right now. However, in Dundalk, we do have a proposal for a new clinic, and it's passed every single stage so far at the government. And they've made that announcement that it's just pending when the funding will come. So we're in the very last stages. It takes quite a bit of work and a lot of report writing and research. But once we get that green light, we'll be able to put a shovel in the ground, and we have the architecture drawings, the renderings of what the building will look like. And so it'll be a really exciting thing for Southgate and for Dundalk to be able to have that space again, so that we can offer things kind of under one roof.
Well, the Southeast Grey Community Health Center and the satellite centers really do amazing work, and they cover almost everything that from infancy right through till for seniors, end of life. And it's remarkable what they do, and the communities are, I'm sure, very grateful for all you do. So we're winding up the show. I mean, a half an hour goes so quickly, and we could talk more and more and more. But I guess what all I have to say is, if you're interested or if you want to join any of the programs, check out the Facebook page, Instagram.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
October 5th, 2014, my daughter was hit by a train. She was walking along the sides of the tracks, and it shattered her world.
Bring on the women! To love! Zach is so serious about being a husband. That sets apart